Medical Director for Telehealth, Dr. Michelle Carney, Medical Director for Infection Prevention, and Dr. Eddie Katemba, Medical Director for our intermediate care centers. They are representative of the medical leadership across our entire system. Clearly, we couldn't have all of us here today to speak with you, but I think if you've got questions, we'll be happy to answer them as they come. My name is Chris Lombardozzi. I am the Chief Medical Officer for Quality and Vice President at Spartanburg Regional Healthcare System. I've been here for about 16 years now and held a variety of roles, including Medical Director of the Emergency Department several years ago. I want to assure the public and our staff and all of our providers that we are well prepared for the coronavirus, whatever the future holds. And we'll talk about that in a moment. As information about this novel coronavirus continues to flow from a variety of sources, we wish to provide reassurance that Spartanburg Regional Healthcare System is prepared to meet the needs of our communities in providing the highest quality of care in a safe environment for all of our patients, families, and caregivers. As you're all aware, there's been a widespread outbreak of coronavirus, or COVID-19, in China, and of course with several other countries, including Iran, South Korea, Italy, and of course some cases here in the United States. Virtually all of the worldwide cases had direct contact to people in China and Wuhan province, or have had direct contact with other people who have known coronavirus confirmation. That said, according to the CDC, the Centers for Disease Control and Prevention, most of the fatalities related to this virus have been in people with older age and with underlying conditions such as diabetes and lung disease. Governments all over the world have enacted a variety of containment measures to reduce the risk of exposures and hinder the spread of the virus. And despite those measures, the CDC does expect that more people in the United States will contract the virus over the next several weeks to months. There's no way to predict the future, but clearly we've already had several cases in the United States, and there's a high likelihood that we'll have more. Spread of the virus occurs by person-to-person contact through droplet transmission. That would be sneezes, coughs. Respiratory symptoms like cough, fever, shortness of breath can be very mild, or they can be very severe. To date, there is no cure, and there's no specific medication to treat this illness. When patients are sick, we provide supportive care until they recover. Current CDC guidelines stress that supportive care. And fortunately, most of the people who contract this virus have had mild symptoms and have not even required hospitalization. Our organization closely follows the CDC and DHEC for guidance. And all patients who present to our facilities, regardless of which facility they come to, should certainly be expected to answer questions about worldwide travel, about contacts, and if they have symptoms, respiratory symptoms like a cough, a cold, sneezing, fever, then we'll ask them to put a mask on when they present to our facilities. The hope is that by doing that, we can prevent further contact and spread of the virus if it should occur here. And I should say that that's the same process that we have right now for any respiratory illness, including the flu. So the procedures that we have had in place for quite some time are the same that we have now for coronavirus. General guidelines, and I think it's important to mention these things, general guidelines, whether you're a healthcare worker or just someone out in the public, are really the same. There's no prevention measure that's 100% perfect, but you can reduce your risk by doing a few things, and they're pretty simple. Avoid close contact with people who are sick. That seems pretty obvious. It's what you do at home. If someone has a cough or cold or the flu, we want to avoid close contact with those folks. You want to avoid touching your eyes, your nose, or your mouth. Again, those are things that we tell people all the time to prevent respiratory illness. Stay home when you're sick. Your boss will understand. It's okay. call in, tell them you're sick, stay home until you're feeling better. And lastly, cleaning and disinfecting frequently touched objects and surfaces using a regular household cleaning spray or wipe is perfectly fine. When you're coughing, I'm sure the kids out there will appreciate this, do the vampire move. Let's see you do that. Cover up that cough or that sneeze and prevent the spread of those droplets. I'm going to answer a couple of common questions that have come up over the last couple of weeks, and then we'll take your questions. I would also say that, as I said before, we continue to follow the DHEC and CDC recommendations very, very closely. We stay updated on anything that comes out from the CDC or DHEC on a regular basis, and we'll continue to do that in the future. So some common questions that we've noticed from families, from staff, from the general public. What are the symptoms of coronavirus? Well, those symptoms are common respiratory infection symptoms. They include fever, cough, shortness of breath. For confirmed cases, these illnesses have ranged from very, very mild. In fact, many people may not have even known that they had it, up to severe illness. And of course, in a few cases, there have been some deaths. What's the incubation period? It's hard to know exactly, but according to the CDC, it can be anywhere from a couple of days up to, say, 5 to 7 days. And the symptoms may appear as early as a couple of days up to 14 days after exposure. And I think that's where that guidance towards the folks who came from Wuhan province were asked to be put in areas where they were going to have minimal contact with other folks for about 2 weeks. What can I do to prevent getting the virus? Well, there's no such thing as perfection here, and whatever we tell you, it won't be 100% perfect, but you can definitely reduce your risk by avoiding close contact with folks who are sick, avoid touching your eyes, nose, and mouth, stay home when you're sick, cover your coughs and sneezes, use a tissue, throw the tissue away when you're done with it, don't just put it back on a table somewhere, and clean and disinfect frequently using common cleaners that you have at home. Should I use a face mask? Currently, the CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including COVID-19. This face mask should be used by people who show symptoms of COVID-19 only to help prevent the spread of the disease to others. The use of face masks is crucial for healthcare workers who have close contact, who will be caring for these patients. And certainly, if you were taking care of someone at home who had this, then we'd also encourage the use of face masks per the CDC guidelines. How should I wash my hands? That one may sound really simple, but what I'd like to emphasize is that effective hand washing takes 20 seconds. And 20 seconds is actually a fairly long time. Wash your hands often, soap and water, 20 seconds, and especially after sneezing, coughing, going to the bathroom. You can use soap and water. If that's not readily available, then an alcohol-based sanitizer is fine. Those are commonly available. I think virtually everybody has at least one or two lying around. Always wash your hands with soap and water if your hands are visibly dirty. Is there a cure? No, there is not. Currently, there is no cure. If you're following the news, then you know that there are attempts out there to create vaccines and potential cures, but according to the CDC, it will be quite some time before any of that is available. Like many respiratory viruses, however, the CDC recommends supportive care and treatment of any of the underlying conditions. National and international agencies are working with private companies to develop treatments and vaccines, but as I said, it will probably be many months to years before those are available, according to their updates. Who should be tested? It's a great question. We get that quite a bit. Should I get tested for COVID-19 if I've got cold symptoms? And the answer is no. There are CDC recommendations out there. If someone has had recent travel to China or close contact with someone known to have the illness, to have COVID-19, and has fever, cough, or shortness of breath, And that person could be isolated in a private space with a face mask while the health department is contacted and an assessment is made on the need to collect specimens for testing. Healthcare workers and other caregivers should wear appropriate personal protective equipment for respiratory illness. There are multiple areas to find updates, and I would encourage the public to get familiar with the CDC and DHEC websites. They maintain all of the facts and figures as we currently know them, and as updates become available or if new guidance becomes available, that will be the first place to find that information. And with that, I will be happy to take your questions.
The South Carolina Hospital Association said there were 5 suspected cases and alluded to them being in Spartanburg. Can you guys confirm that and what you guys found?
So there have been suspected cases throughout South Carolina, and I imagine throughout most of the United States. To date, we have 0 confirmed cases in South Carolina.
And can you describe the testing that they underwent?
Yes, so testing is fairly straightforward. If a patient is tested for coronavirus, it is a swab, sort of think of a Q-tip type swab of the nose and the oral pharynx, and those are run through the CDC. They are not run at our facilities or any other facilities in South Carolina. Any other hospitals, I should say, in South Carolina.
Can you talk about the panic maybe by some people, and is that warranted, or should they just simply follow the precautions that you guys are recommending?
Yeah, it's a good question. Throughout history, there have been viral infections that have come and gone. This is certainly one of them. It is serious. There have been a lot of fairly rapid transmissions, and there have been deaths. It'd be easy to say that it's not serious by comparing it to flu statistics. I don't think that's fair. I think it is serious, and we need to take it seriously. Our intent here, and I think the intent of most healthcare institutions throughout this country as well as all others, is to do just that, to show that 1, we understand what's going on, 2, we have a plan in place, and 3, we're well prepared to handle this sort of outbreak. The second part of that, while the healthcare institution can be well prepared, we want you, the general public, to be well prepared and to do all the things that you can do to help prevent spread. And if we do that as a country, that will greatly diminish the overall risk. So the things that I just mentioned, good hand washing, not touching your face and your mouth and your nose, wearing a mask if you come into a doctor's office and you've got a cough or cold symptoms, good hand hygiene at all times. Those are the things that are going to help prevent the spread of this illness, just as it would for a cold or the flu, those types of respiratory illnesses.
You mentioned suspected cases. Do you know how many and where?
I don't have exact numbers. A suspected case could be anyone who has some mild symptoms but is fearful that they might have the virus, and through a fairly straightforward screening process, we determine that they just don't meet the criteria. That doesn't mean that the patient wasn't concerned. It just means that they are much more likely to have something else. And oftentimes we can confirm that, for instance, a flu test or a chest x-ray, or it's clear that they have some other diagnosis.
Was Spartanburg Regional the ones who tested those, or any suspected cases of coronavirus?
So we have had patients who have presented to our departments and to our facilities with concerns. We've not had any that have tested positive through the DHEC or CDC process.
You listed out the normal things you should be doing to try to prevent any chances. People with auto or with immune deficiencies, should they do anything different than a normal person?
Yeah, so it's a good question in terms of vulnerability. And if you are someone with an immune deficiency disorder, then you should probably be taking precautions that you would take under an ordinary day anyway. That same person is vulnerable to the flu. That person is vulnerable to pneumonia, to other things. Should they be taking extra precautions? Probably. Should they be trying to avoid close contact with other people who are ill? I would say yes. But not because of coronavirus, because they just have a much higher susceptibility towards any infection. Yes, sir. Yeah. Go ahead.
Is there any messages you're sending out to the schools?
So at this time, certainly we are not in charge of the school districts. I know that they have task forces that are actively looking at this, and certainly they'll be working with state and local authorities in terms of their decision-making process. To the best of our knowledge, there are no decisions at this time regarding schools.
Can you talk about some of the additional steps or protocols you have taken since the outbreak of the coronavirus to prevent?
So this is one of those steps, and I think communication is probably the most important thing we can do. When you've got a respiratory illness where the precautionary measures are fairly straightforward, where there is no defined cure, where there is no defined treatment, then preventing exposure and maintaining supportive care from a medical perspective is what we can do. But the most important thing that we can do as a community is to prevent that spread in the first place. And so it kind of goes back to, and I know it sounds really simplistic, but it gets back to good hand washing, not touching your face, preventing the coughs and sneezes from going to other people. When you're sick, stay home, don't go to work. Those are the things that are really the most important in terms of preventing the spread of this disease through any community.
So you have an adequate supply of materials to test in the system here, and then you send these samples to Columbia because they can.
So let me clarify. The testing, the test is not ours. It is through DHEC and the CDC. They are the ones who have the test kits.
Okay.
We do not. So the process is, if there's a suspected case, we would notify them. We do all the appropriate medical things. We notify them, they get involved, and then they are the ones who do the testing and run the tests.
And they can do that from the local health department, or
It's through the health departments, yes.
And do you have a sufficient supply of materials needed for the employees here, such as the respiratory masks, the gowns, gloves, etc.?
We do. We have plenty of equipment.
So just to clarify, you mentioned that the people who passed away were those who had underlying issues such as lung issues and diabetes. Did I hear that correctly?
What we have, and I think if you look at the CDC website, that's exactly what they say, that the folks who have died, for the most part, have had significant underlying medical problems. And so they mentioned diabetes and lung disease on their website.
Well, my question is, we're in the South, a lot of people are dealing with diabetic issues. Should they be concerned that they're susceptible to this?
So all the doctors here would tell you that, similar to the question about being immunocompromised, folks with diabetes have a higher risk of developing a variety of medical problems. The actual risk of coronavirus, at least in our community at this time, is extraordinarily low. Is that to say that we won't have coronavirus in our community at some point? I don't know. It's probable that we will, but currently we don't. I would say to anyone who's diabetic, please make sure you're getting the right medical care. Please make sure you're taking your medicines. Work on your diet, work on your exercise, work on the wellness that we would hope you'd be working on a daily basis anyway.